This is a patient who presented after a bungee cord injury which resulted in an anterior dislocation of her multifocal IOL. She'd been happy with this restored lens, and so the decision was made to attempt to try to salvage it. This is a new device I helped to create in conjunction with Diametrix called an IOL punch. It's the first intraocular IOL punch, and you can see the action and the mechanism of the punch here. After a discussion with the patient, the plan was to try to salvage, recenter, and scleral fixate this multifocal IOL. 2 paracenteses were created, and the eye was filled with dispersive OVD to tampen on the vitreous. A 2.4mm steel keratome blade was used to enter the anterior chamber, and the IOL punch was inserted. The zonules are intact superiorly, thus suture fixation is only necessary on the inferior side of the IOL bag complex. This punch and rescue technique allows the patient to avoid explantation, maintain their multifocal IOL, and recenter the IOL with precision. This is the first intraocular creation of a hole within an IOL, allowing the lens to be salvaged. The cord piece from the IOL was recovered, and I zoom in on that here after placing it on the cornea. A 5-O suture is then inserted through the superior paracentesis, and, using a micrograsp forceps, is docked with a 27-gauge needle located inferiorly, which is aligned with the haptic optic junction, about 2.5mm posterior to the limbus. A 6-O or 7-O purlin could also be used, which would allow an easier pass through the hole in the IOL and provide similar stability. After retracting the needle through the sclera, I create a flange on one side and cinch it down onto the IOL. The IOL bag complex is then reposited posterior to the iris, and some more vitrectomy was carried out. The IOL was then centered, and the final flange was created using cautery. My call was given to constrict the pupil, and a 10-O nylon suture was placed in the wound. At post-op day 1, the patient's vision was 20/40, and the lens was pretty well centered. At post-op week 1, the patient felt her vision had returned to baseline at 20/20.